Hello viewers, have you, or someone you know, noticed a painless swelling in the scrotum? It might be more common than you think. Welcome to our guide on hydrocele. We're going to walk through everything, from what causes it, to what it feels like, to your treatment options. This is a straightforward men's health topic, and we're here to explain it plainly. Let's start with the basics. Picture this: inside the scrotum, each testicle is naturally surrounded by a thin layer of fluid, like a tiny protective cushion. A hydrocele happens when too much of this fluid builds up, creating a soft, fluid-filled sac around the testicle. Think of it like a small, water-filled balloon that develops in there. The key thing to remember? While it causes visible swelling, it's usually not painful. It's more often a source of curiosity or mild discomfort than sharp pain. This fluid buildup happens inside the scrotum, the skin sac that holds the testicles. It can surround just one testicle, or, less commonly, both. And it doesn't discriminate by age. It can be present in a newborn baby or develop in a grown man. The location is always the same, but the why can be different depending on your age. So, what's the difference between normal and a hydrocele? In a normal, healthy scrotum, there's just a minimal amount of that lubricating fluid. The testicles feel firm and distinct. With a hydrocele, that fluid production goes into overdrive or doesn't drain properly. The result? That side of the scrotum becomes enlarged, often smooth and taut to the touch. If you were to imagine it, the testicle inside might feel like a small pebble at the bottom of a water balloon. Doctors classify hydroceles into two main types, based on when they appear: congenital, meaning present at birth, and acquired, meaning it develops later. This distinction is really helpful in understanding the cause and the best approach. Congenital hydrocele is very common in newborns. Here's why: as a baby boy develops before birth, his testicles descend from the abdomen into the scrotum through a tiny tunnel. This tunnel is supposed to seal shut. If it doesn't close completely, fluid from the abdomen can trickle down and get trapped around the testicle. It's a simple developmental quirk, and in most cases, it fixes itself. An acquired hydrocele is one that shows up later in life, in older children or adults. This type isn't about an open tunnel. It's usually a sign that something has upset the balance in the scrotum. Often, it's a response to an injury, an infection, or some inflammation. The body produces extra fluid as a reaction, and it just stays there. For adults, the triggers can vary. It could be a direct trauma or injury, a sports impact, for example. It could be an infection in the epididymis or testicle itself. Sometimes, it's general inflammation from another source. And in rare cases, and this is why we don't ignore it, it can be associated with a testicular tumor. That's the main reason doctors take it seriously, to rule out other possibilities. For infants, we go back to that little tunnel, called the processus vaginalis. If it stays open after birth, abdominal fluid can move back and forth. You might even notice the swelling gets bigger when the baby is crying or active. It sounds worrying, but it's typically harmless and resolves as the child grows. Certain things can make a hydrocele more likely. A history of testicular injury tops the list. Infections, including some sexually transmitted ones that cause inflammation, are another. The natural aging process can sometimes affect fluid balance, and even previous surgery in the area, like for a hernia, can sometimes lead to one. What does it actually feel like? Most men describe it as a gradual, painless swelling. There's often a distinct feeling of heaviness or a dull, pulling sensation in the scrotum. It might cause some awkwardness or discomfort when you're walking, sitting for a long time, or being physically active. It's more of a persistent presence than a sharp pain. Now, pay attention here. While pain is rare, if you experience sudden pain or tenderness, if the swelling increases rapidly over hours or days, or if you see redness, warmth, or have a fever, these are red flags. This could signal an infection or another urgent issue. Don't wait, see a doctor right away. Let's address the fear head-on. In the vast majority of cases, a simple hydrocele is benign. It is not cancer. The fluid is clear and harmless. It very rarely impacts fertility directly. So, take a breath. However, and this is crucial, it needs to be evaluated because more serious conditions can look like a hydrocele. Getting a diagnosis is about peace of mind as much as it is about treatment. This is a common point of confusion. Both can cause scrotal swelling. A hydrocele is fluid. A hernia, specifically an inguinal hernia, is often a loop of intestine that has pushed through a weak spot into the scrotum. Hernias often ache or cause a sharp pain with coughing or lifting. They may come and go. A hydrocele is usually a constant, fluid-filled swelling. A doctor can tell the difference with a simple exam. Diagnosis is straightforward. It begins with a conversation, your medical history, and a physical exam. The doctor will gently feel your scrotum in the clinic. The most definitive test, though, is a scrotal ultrasound. It's a painless, quick scan that gives us a perfect picture of what's going on inside. You might see a doctor do a classic, almost old-school test called transillumination. In a dark room, they press a small, bright light against the swollen scrotum. If it lights up with a red glow, it confirms it's clear fluid. Solid tissue or blood would block that light. It's a simple but clever trick. The ultrasound is our gold standard. It does three things beautifully. First, it confirms the diagnosis by showing the fluid pocket. Second, it lets the doctor clearly see the testicle itself to make sure it's healthy and rule out any tumors. And third, it checks the other structures. It's the complete picture. Here's the good news, treatment isn't always necessary. If the hydrocele is small and isn't bothering you, the best course is often watchful waiting. This is especially true for infants, where they frequently go away on their own. Sometimes, the best medicine is just time and regular checkups. It's important to know, there is no pill that makes a hydrocele disappear. However, if the cause is an infection, antibiotics will be prescribed to treat that. And if there's discomfort, over-the-counter pain relievers can help manage it. The medicine treats the cause or the symptom, not the fluid sac itself. For a hydrocele that's large, uncomfortable, or persistent, minor surgery called a hydrocelectomy is the definitive fix. It's a common, low-risk outpatient procedure. The surgeon makes a small cut, drains the fluid, and then either removes the sac or repairs it so fluid can't collect again. It's highly effective. Let's demystify the surgery. You'll be under anesthesia, comfortable and unaware. The surgeon makes a small incision, usually in the scrotum or sometimes the lower abdomen. They gently drain the fluid and then deal with the sac, often by sewing it up behind the testicle. The goal is to prevent the fluid from coming back. Recovery is generally easy. You'll go home the same day. You'll have some mild to moderate swelling and discomfort for a week or two, which ice packs and pain medication manage well. The number one tip? Get some snug, supportive underwear or an athletic jockstrap. That support makes a world of difference in your comfort and healing. As with any surgery, there are small risks, but they're uncommon. These include infection at the incision site, some bleeding or bruising, which usually looks worse than it is, and a very small chance the hydrocele could come back. Your surgeon will discuss all of this with you in detail. For parents watching, if your baby boy has a hydrocele, don't panic. The vast majority resolve on their own by age 1 or 2 as that tunnel finally closes. Surgery is only considered if it's very large, if it's what we call communicating with the abdomen, or if it's still there past his second birthday. The prognosis is excellent. Directly? Almost never. The testicle inside is untouched and healthy. However, a very large hydrocele could theoretically raise scrotal temperature slightly. More importantly, the underlying condition that caused the hydrocele, like a severe infection, could affect fertility. That's why we say, treating the cause protects your future. Can you prevent it? Not always, but you can be smart. Wear protective gear during contact sports. Practice safe sex to avoid infections that cause inflammation. And get familiar with your body, perform regular testicular self-exams so you know what's normal for you and can spot changes early. So, when should you make that appointment? If you notice any new, unexplained swelling in your scrotum, any pain or redness, or if a known swelling suddenly gets bigger or becomes painful, Trust that instinct. It's always better to get it checked and be reassured. Let's clear the air on some myths. Myth: it must be cancer. False. It is almost always benign. Myth: it's caused by something I did. False. It's usually not your fault. Myth: surgery is my only option. False. Many are simply monitored. Let's wrap up with what matters most. A hydrocele is a common, treatable buildup of fluid. It's usually not a sign of a serious disease. But getting a proper diagnosis from a doctor is the single most important step for your health and your peace of mind. You don't have to just live with the worry or the discomfort. Thank you for taking the time to learn about your health. If this video raised any questions for you, please talk to a urologist or your primary care doctor. They're there to help. If you found this guide useful, please like, share it with someone who might need it, and subscribe for more clear, compassionate health information. Take care.